Welcome to Free Mind, which is a project about information and different ways of looking at information. And instead of telling you about it, I'm going to show you what I'm talking about. So first, I need to share my screen. All right. So hopefully you can see my screen. So the other day, I was on YouTube watching a video by by a top scientist that I've been following through Zoe, which is the company that he helped found. His name is Tim Spector. As you can see here, he's a professor of genetic epidemiology in London. And he was talking about data, COVID data specifically, from the UK. And he was making an argument and a claim that everyone should be vaccinated according to the data that he's seen. This data, of course, is from the Office for National Statistics, as shown here. And I mentioned that because I was familiar with data that was talking about the UK as well, and looking at deaths by vaccination status, and told a very different story. So I was alerted to grab that information that I had been looking at and start to compare and figure out why was he claiming something that was very different than what I was seeing. And so, excuse me, to get into the details here really quickly, the claim that he was making is about this number, which is almost 39,000 deaths of people that are not vaccinated, versus 458 people that are fully vaccinated. Now, if you saw these numbers, you would definitely agree that you should get vaccinated, right? Based on this data, based on exactly what we're seeing here. And as you can see, yeah, this is the vaccinated group here, and these are different stages of vaccination. So why I was alerted was because I was looking at different data, and what I saw in this different data set was, and this is it here, which is actually from the Public Health England. This is where the data is coming from in their technical briefing from July. And I think one thing I need to also note about the data here, which we were talking about, right, is that I found the actual data table, and it shows that the dates that this data is covering is between January 2nd and July 2nd. And so that's important to note, because the data that I'm familiar with here from the Public Health England, go back to page 18 where the table was, is that this data table is from February 1st. So this data does not include January. And I'll get back to January, just keep that in mind. But what this data table does and shows, which I really loved and why I've been referencing this data about COVID, is that the data that they're sharing here not only shows Delta, the Delta variant, all cases, it breaks it down by age, people under 50 versus over 50, which I found to be helpful. It also breaks it down by different stages of vaccination, and unvaccinated, which is this far right column. And they also not only just show cases, they show hospitalization, and then down here, they show deaths. And so let's remember the number from the one before, which was 39,000 deaths, right, of unvaccinated people. So now we're looking at February to July. We're seeing 165 total deaths. That's all in. That's under 50 and over 50. And that is drastically different, right, than the 39,000 number that we were seeing before. So let's go back to that January part, right? Because January is the month that we're missing in this data set. And what happened in January? So this is the data from the UK, and this is total deaths per month, all in, vaccinated, unvaccinated, all that, all cases, all deaths in the UK. And you look at each month, right? These are the deaths, and you look at January. This was the biggest month that the UK had, and I believe most places in the world had a really big surge in January. And so this month, and then the number of deaths that occurred significantly skews the data, right? And the question that comes to me is, when did vaccination start? It started in December of 2020. So it started in here, but that was only focused on the extremely at risk, the elderly, some frontline workers, and they really didn't get most people to be vaccinated until, I believe, in April is when I believe from other data that I've looked at, where they had 80 to 90% vaccination rates of people over 50. So that's just over 50, right? But that's when you would start to really, I think, as a scientist, and I am not, but I would say once people are vaccinated to a certain level, then you could start to look at, was the vaccine effective or not? And it wouldn't be until April that you could see that. And so the problem here that I'm bringing up is that if you use this January data, which it was in the middle of vaccination, so to say that all these people that died that were unvaccinated, well, of course, most people weren't vaccinated at that time. So this unvaccinated number from January is huge, and it skews this data to look like, well, you should get vaccinated. And even though that this was in the middle of the vaccination rollout, vaccine rollout, and it doesn't really tell the story because it was in the middle, or really in the beginning of when that happened. So we really aren't able to have a proper way of looking at this and a proper way of making the argument that you should get vaccinated. And so going back to the original data that I've been looking at, and I think one of the narratives that I think has been really clear from the beginning that I disagreed with is that there's been this narrative that it's a pandemic of the unvaccinated. Now, this data doesn't show that, because right here you see the total deaths of unvaccinated, 165, and then you see the total deaths of vaccinated, 224. Now, this is where a lot of people got carried away in the other direction and made some mistakes as well, some wrong assumptions. And just because there's more vaccinated deaths versus unvaccinated doesn't mean that you shouldn't get vaccinated. What that means is that it's actually, we're looking at pure numbers here. We're not looking at percentages. There's actually way more people right now that have been vaccinated than not. So you should expect to see more people by number that are dying that are vaccinated than unvaccinated, right? So you can't make that argument that you shouldn't get vaccinated because of this number. That's also misusing and misusing the data and misunderstanding the data. So, but what you are seeing here is that there is not a clear correlation between unvaccinated and vaccinated in what's happening here. You would see significant numbers in the unvaccinated if people were dying at a significant rate. And I think what you should make note of is that the under 50 versus over 50, you'll see these numbers here show that what we continue to have is a pandemic of the people that are over 50, a pandemic of the people that are likely suffering from comorbidities and other chronic diseases. And that's one variable that's not in this data set, which I found to be really important and something that I was able to find within the CDC's data for the US, which is of course different country, different data set, but was really important to see that 94% of the deaths from COVID in the US were people with comorbidities, other chronic diseases and illnesses, and that was on average of 4. So an average of 4 other comorbidities, which to me is the biggest driver of death of COVID, and likely the biggest driver of severe illness of COVID, the biggest driver of death of hospitalization, and even just getting COVID, I believe, is all connected to that. And that's the biggest variable, which you don't see in this table, and you certainly don't see in this table and this data set. And you don't even see this data set using age, which to me is another part of that same argument, because it's not about age, it's about comorbidities in my mind. Age is, of course, correlated, because as you age, and if you're living in a Western civilization that is not healthy, and there's a lot of issues with lifestyle, as you age, of course, you will have more disease, and that will look like, oh, well, it's age, but it's actually lifestyle over time, which becomes chronic disease, comorbidities that we're seeing. So my point here is that you can see how data can be misused, you can see how data can be skewed, and these are top scientists. This is, as I mentioned, there's a lot of people that are viewing this, that are looking at this as an authority of information. And Zoe, I believe, is a great company doing great things. I believe Tim is a great scientist as well. And you could see, and I'm not blaming Tim for this, I am actually a bit upset with the Office for National Statistics, because I believe that they're not properly representing their data. And when they create tables like this, to me, that's a problem. As you can see, it leads to problems. So what I'm trying to make a point about is, you can see how easily this can happen by people that are very expert in their field, very excellent scientists, people that are looking at data and missing some really important variables, some really important parts that create the story, really important parts of the data. And for me, it's not just about more data, it's about getting the right data. And I think if you're looking at COVID, I continue to ask questions about, what are the comorbidity numbers? What are the issues with other chronic diseases? Are we breaking this down by vaccinated versus unvaccinated? What month and when was when were people getting the vaccine? And you can't just look at these different pieces of data and draw massive conclusions based on anything. Either way, whatever way you want to go, there's all these variables that are in play. And I think it's important to consider time, when people got vaccinated, what percentage of the population is vaccinated, and you can't just pull claims and narratives from data without really having the context of the entire situation. So these are a couple ideas that I've had that I felt really important, that was important to share. And hopefully it was helpful for you. I will continue to create more videos in the future on YouTube, and kind of showing my process, my way of thinking, and also diving into some of these data points and narratives that I think are really widespread on the internet, on mainstream media, and the news. And I think it's important to have a nuanced and fresh look. So again, thank you for listening and watching this video, and there'll be more soon.